3, 2, 1. We are live, Matthew.
Hey guys, Matthew here at Dr. Jason Emer's office. We are performing a radiofrequency treatment to our patient who just had our Facetite procedure. If you guys caught us live, you did see him getting it here in office. And it is a radiofrequency treatment that helps loosen up that tissue and helps reduce inflammation and swelling. So he is 1 day post-op. You can see here, if you guys come in, all this area was treated, all of it. So right after the procedure, you're really swollen. He's wearing a mask that kind of helps compression. And then this radiofrequency treatment is going to help really relax that tissue. It's normal to feel a little tight afterwards. What does our patient tell us? How do you feel right now? 1 day post.
Well, I'm not in any pain. I feel normal. With the exception of the obvious swelling, but it's not painful.
Okay. Do you feel tight at all, or how would you describe your neck area?
It's a little tight. I mean, on the scale of 0 to 10, I would say it's probably about a 3 or 4. I mean, I have to remember not to twist when I twisted my head around really quickly, I felt it. But other than that, it's not an uncomfortable tightness.
Okay. Yeah, so it's normal to feel a little tight here. So what we're doing, we're kind of relaxing that tissue. And by doing so, we're also allowing the excess fluid, the inflammation to kind of subside a little quicker. He's going to see his final results over the next few months. But in the next few weeks, all this here is going to subside and it's going to retract. The reason why is because with the technology that Dr. Emer used during the procedure, in Facetite, we have this pull here. So when we do the radiofrequency treatment, all this is going to get pulled back. So that tightening is going to take place. So with the radiofrequency, we're just treating this tissue here to kind of help reduce inflammation, reduce the swelling, and overall help the healing process. It's one of our post-operative treatments. We also do this for our surgical patients on their body. So say you get liposuction on your abs and you want tighter skin. This is going to help reduce that inflammation after surgery. It's going to help tighten the skin, kind of reduce that inflammation and help speed up the healing overall. So why don't we ask our patient now, how do you feel after the procedure? Would you do it again?
Yeah, I'm looking forward to seeing the results. I had a bit of anxiety because I thought, it's going to be painful, but it wasn't. If the procedure could be considered pleasant, it was fairly close to that. I was in no pain or anything else. I mean, I haven't been in any pain, so yeah, it's kind of what it was. It was a lot less problematic than I anticipated.
Great to hear.
Hey, Matt, someone's asking about radio frequency. That's what you're using?
Yeah, so right now these probes here, they're heating up the tissue, and we have a gel on the skin that helps this glide, and it helps the tissue kind of heat up. I'm monitoring the temperature on a screen, so as I'm moving, we're heating up the tissue beneath. So we're actually causing the tissue to tighten further and reduce inflammation, because once you heat up the tissue, you allow the fluids to kind of migrate and everything to kind of move through the lymphatic system. Your lymphatic system in your face, anything below the mouth is going to go upward here. Because just behind our ears, we have our lymphatic system kind of buried there. It's also in our armpits and our axillas. So what I'm doing now is I'm actually helping the lymphatic fluid kind of move across and go where it needs to go through our body's highway system. That's going to help reduce the inflammation, but once again, and kind of speed up that healing.
Someone's asking if he just did Facetite last night. Yes, he did. This procedure was last night. If you look at our lives on IGTV, you will see it there. Is he awake? Patient, are you awake?
Very much so.
He is awake. Is this painful, or how would you describe this treatment right now that you're getting?
No, it's not. I mean, I guess I can't really describe it. It's not painful. It just feels like someone's put some petroleum jelly on my face and just rubbing like a warm stone over my face. And it's not hot, but it's like a hot stone spa treatment.
Yeah, so that's kind of how I like to describe it to patients. It's like a hot stone massage, essentially. So we're moving in a quicker pace here because we don't want to stay in one place and heat up the tissue too much because then it would burn.
Someone's asking, saying that they need this. Yes, DM us, send us your contact info. We would love to get in contact with you.
So this is not just for surgery, you guys. This is also for any skin tightening that you want. You can totally achieve that with this. Repeated treatments. Just call us, get in for a consultation. We'll help you find the right device that we have because we have so many. But with radiofrequency, it's not only for surgical patients. Anyone can totally do this to achieve tighter jawline, tighter neck. Now it doesn't remove fat, but it helps skin tightening.
And what would be the price range for Facetite? Someone's asking that right now.
It really depends, you guys. It varies. So you got to make a consultation appointment. And we can definitely help you with that.
We are happy to talk to you.
Yes. Well, thank you guys so much for tuning in. Once again, we're doing the radiofrequency treatment post Facetite. Our patient here will continue to do these treatments, alleviate that swelling, and have a tighter jawline and better submentum area. Thanks again, guys, for tuning in. We'll see you next time. Give me some gauze, please.
Where was that? Gauze pads?
Oh.